Welcome to the Irish Occupational Therapy Podcast. This series, Series 3, is focused on using occupational therapy wisdom to support parents with their child's development. So we'll be exploring key areas such as sleep, feeding, toileting, play, and communication with insights from experts in occupational therapy and other fields.
Our goal is to normalise the challenges of parenting and provide practical tips and advice. You'll hear from dedicated professionals who will share their expertise and personal experiences to help you navigate the complexities of raising children.
Welcome to the Irish Occupational Therapy Podcast. It's not often that we get to speak to a poo expert, but we are absolutely delighted today to be talking to a poo expert. Actually, former clinical nurse specialist Anne Costigan, who has moved into this area of toilet training, constipation support for parents on this really potentially fraught area of toileting. So you're really welcome, Anne. Thank you so much for joining us.
Thank you guys for having me. I'm delighted to be here speaking about poo because, as you said, it's a subject that's not widely spoken about. So it's definitely great to give it a bit of airtime.
And what was it, Anne, that kind of led you down this path to, you've set up Poo in the Loo, which is an amazing Facebook page, Instagram page, a site for parents, a huge helpful resource. What led you to be interested in this particular area?
So when I was working as a clinical nurse specialist, as a colorectal stoma nurse, we would have seen a lot of children who were chronically constipated. So these kids would have been constipated for years and years and years and would have had to end up coming to our service for more invasive procedures to get them continent. So it sparked my interest because parents, when they came to me, had very little knowledge of constipation, why it happened to their child, what they could do about it. So I started then digging in a little bit more to see what information was actually available for parents, and very little. And it's just that recognition of constipation in children, because it's quite different to an adults. Because for us as adults, if we get constipated, we recognize it quite soon on. But for kids, it can present quite differently, and it can present as they're pooing an awful lot, just small amounts more often, or it can be that they're really painful poos that they're passing. So I just wanted to get the correct information out there for parents and to demystify the use of laxatives in children, because that's a huge fear that parents have. And what I typically would have seen was parents would have started the laxative under the guidance of a GP, but then would have stopped it as soon as they started pooing because they felt, oh, I can't keep giving them a laxative, it's going to make their bowel lazy. But I wanted to really demystify that, because what in actual fact can happen is if the kid isn't treated correctly for their constipation, that rectum can become overstretched and become redundant after years of being chronically constipated. So I really wanted to get that information out there for parents. Again, then teach them about toilet training too, because that can be a huge area for parents. A lot of anxiety around it for parents, and just not knowing what the right way to approach it is, because there's so much different information out there. The minute you Google potty training, you see these flash ads for get them done in 2 to 3 days, and that's not realistic, for most kids. So it's just to get proper information out there for parents.
And I think that's really important. And I see that a lot in children that I work with and support, where parents think that it's actually the opposite that's going on, not constipation. They actually think their children have maybe chronic diarrhea, when actually it's not. It's like a backup and overflow, and it really does impact on the toileting process. So these children maybe cognitively are ready to toilet train, but the constipation is a huge barrier for them.
Yeah, absolutely. Because again, as you said, it can be so confusing when they're pooing loads. How can you actually think they're constipated? And parents find it really hard to understand. So it's really important that it's explained to parents, and using visuals, using the sweet corn test as a way to demonstrate how slow their transit time is and how much poo can be in there is really, really important. So education is really key. And so looking at the signs of constipation in kids, so the typical ones are those big hard poos that they're passing infrequently. So if you're pooing less than 4 times in a week for a child, that can be constipation. If it's more than 3 times in a day, that can be constipation. So again, what can typically happen with children is they feel a poo coming, they may leave out a little bit, or it might be a bit of an overflow that's happening, and they squeeze and hold on to the rest of it, and then they'll get an urge again a while later, they leave out another little bit, or it could be the overflow that's coming out. So that can be happening quite an awful lot for parents, and they're thinking there can't be constipation, there's loads coming out. And the typical things that people think of are those little pellet rapid dropping poos, which are really typical in babies and in older children. So there's different varieties of poo, but the type of poo they should be passing is the type 4 poo on the Bristol stool chart. So that's a chart I think every parent should have printed off and up in the bathroom for kids to understand what the normal poo should look like, and for parents to educate them too what a normal poo should look like. So, and it's open up the conversation with the child and teaching them from as young as you can about what poo looks like.
You're describing there nearly like a sensation that a lot of children do experience, that fear of releasing, that holding on, and how that then it's like a vicious circle with constipation, isn't it? That holding on and not allowing that release.
Yeah, so that poo withholding cycle can happen really, really quickly. And it can happen for a couple of reasons. The first one, the most common one, is that a child may never have suffered with constipation before. They start toilet training. Next thing, they pass a poo into the potty. They look down and see this poo for the first time. So they may never have seen a poo before, because typically what we do when we change a nappy, we wrap it up really quickly, get rid of it, smelly, oh, it's disgusting. We say all these things about poo, so the child automatically doesn't see the poo, sees it for the first time in the potty and thinks, oh my God, this is falling out of me. I don't know what this is. And they get a fright, and that can be really, really common. Or it can be the smell of the poo. And then they start thinking, I don't like that, and I'm not going to do it again. So they start holding on to the poo. And then the longer the poo is staying in the rectum, the drier and harder it's getting, because that's just the function of your large bowel, is to draw water out of your poo. So then you're into that vicious cycle of a dry, hard poo. They need to poo again a couple of days later. They might pass it out and they might experience pain. So then they're withholding again, and you're back into that vicious cycle really, really quickly. So it is important to identify it as soon as you can and act on it. Don't wait it out and see how things progress. You have to kind of make sure and look at their fluids, look at their diet, and if needed, get a laxative started as soon as you can. That's really important. And then for kids who may have experienced pain or constipation in the past, even as a baby, just one episode of it, when they do start toilet training, then that feeling of letting go of this poo, it's a totally new sensation. They had the nappy before up against their bum, and now they could control the force and the speed that poo was coming out of, but now they're sitting on the potty and this is just falling out of them. That's a totally new sensation for them, and that muscle memory can come back into play, thinking, I didn't like this sensation before, so they start clamping down and holding on, and again, you're into that withholding cycle so quickly, and it just happens really, really quickly for some kids.
I saw on your Instagram page you've got some lovely downloads. You mentioned the Bristol chart there, so downloads that parents can kind of tape something up. You mentioned there the sweet corn test. Tell us a bit more about what that is.
Yeah. So this can work in two ways. It can work really well, but it can turn a kid off sweet corn if that's their favorite vegetable. So use it wisely. So basically what the sweet corn does is it shows us their transit time. So that's basically the time it takes from food to go from their mouth to their bum, and the food to be produced. So with the sweet corn, it doesn't get digested. So the sweet corn remains whole, and so we see it in their poo. So for a child, it should take between 24 to 36 hours for that sweet corn to appear in their poo, and that's their normal transit time. So if a child hasn't got a backlog of poo, it should come out within that length of time, and then you know that there's no backlog of poo there. So it's a really simple test. If a parent is a little bit concerned, thinking, I'm not quite sure if they're constipated or not, lots of the time it can be that the poos are really varied. They can have a dark poo, they can have a light poo, they can have a small poo, they can have a normal poo. And so it can be quite hard to kind of pin down. So the sweet corn test is another good visual way, to understand how long it actually is taking. And it's great for the kids when they're a little bit older to look as well and to be a little bit of a poo investigator. And it can be a great way, if they are scared of their poo, to kind of get interested in looking at it too.
And what about readiness for toilet training? Because we will have parents that are listening who have children with additional needs. So we're not thinking really about age. What are the signs that, okay, maybe this is a time to start the process? What do parents need to look out for?
Yeah, so again, it's really important that parents do understand that not every kid will actually show you signs of readiness, and especially kids with additional needs. So that can be a bit leading for parents, and they think, sure, they'll just show me absolutely no signs. So for some kids, they can really be delayed with their toilet training for that reason. So it is important to kind of look at, physically, we know from the age of 18 months that the bladder is beginning to get more mature. It can hold on to more urine, and we start noticing that they're drier for longer periods of time during the day. So that's from 18 months of age, physically, you can toilet train your child. So it is a little bit more difficult because, again, developmentally wise, maturity wise, it can be hard to get a child to sit down in the potty and do what you're asking. So other signs of readiness that are really important are that they can follow instructions, understand what you're saying, pulling up and down clothes. But physically, the bladder being able to hold onto urine is one of the most important things. So a parent can check that really simply by obviously checking their nappy, but our nappies these days are really, really absorbent. So we may not know that they've had a wet nappy until there's a good bit of wee in there. So you can do the paper roll test, and that's just getting a bit of kitchen roll, rolling it up and popping that into a dry nappy, and then checking that bit of kitchen roll every 20 minutes or so, and doing that a few times throughout the day. And that can give you a really good indication of how long they're actually able to stay dry for before starting toilet training. One other big thing is this constipation, making sure that there is no issue with constipation, keeping a good diary for a week-long period to see how often they're pooing, what the poos look like, are there any episodes or any indications that there is constipation, and the position that the child is in when they're pooing is really important. So are they standing up to poo? And this has been proven to show that they may have more difficulty toilet training if they are standing to poo before you start, because that's a typical withholding stance that kids will use. And a lot of kids will adopt that stance really quickly if they pass one hard poo in the past. So you can imagine if a child is so used to standing to poo and now we've been asking them to sit down to poo, it's a whole new transition for them. So that's something that we need to look at and work on as well before we start toilet training.
Oh, that's a key part. I never even thought about the standing
Yeah.
actually bit. Yeah, yeah.
Yeah, and it can be really typical. A lot of kids, my youngest one, she actually does it at the moment, and would suffer with constipation since she started on solids. And again, she was a great grubber. She loved the food, and sure, I was loving it. She was eating away loads, but typically then she wasn't drinking enough, and she became constipated really, really quickly. And now she's nearly 2 years of age, and we're on top of her constipation now, but that behavior is still the same. She still stands to poo. So what I've been doing with her is when I know she's giving me the look when she's doing a poo, and I'll go down and do some frog squats. I'll get the other kids to do frog squats as well and get her to try and get her to squat down. But it is important that trying to make them change position while they're doing this is really difficult. So practice these little things before they need to do a poo, and then be playful about it. Try not be stressed about it. Try not put pressure on them to get into a different position, because you know yourself, if they're in the middle of trying to poo, they're really concentrating on what they're doing. So it can be hard to engage with them while they're trying to do a poo.
That's really helpful. And I know, and you provide consultation to parents who are struggling with toileting difficulties across the board. What kind of things do people come to you with, and what kind of approach do you take then in terms of figuring out what it is that's actually going on?
So I will deal with kids who have started toilet training and have regressed, or they've been trying to toilet train and it just hasn't been going. We're not getting anywhere with the child, or else it is their child is constipated, that they have poo withholding, they have fear of the poo, they fear the toilet. So all of those issues I will deal with. So basically what happens is I will send the parent an assessment form that they fill out. I would always stipulate first that if you're concerned about your child's toileting habits, anything about their health, to make sure and get them checked by their GP first. So especially for the constipation, you want to make sure that they're ruling out any underlying cause for the constipation. That's really important. And again, I don't prescribe, I don't diagnose, so that's really important that GP does that first. And then I will go through what their issues are, and we'll talk through about the child, what kind of personality they have, about their toilet training issue. When they attempted toilet training first, what were the child's signs that they were ready? Why were the parents doing it? Were they under pressure to get it done for preschool, which is a big, big one for a lot of parents? So we go through all that, and we basically then make out a plan. We identify what the problems are. We do a step-by-step plan of what parents need to do. And then the most important part of the consultation is the follow-up, because again, especially around the use of laxatives, it can be really confusing for parents to know what they should be doing. So I will always look at pictures of their poo, of the child's poo, so they'll send me those pictures, and I guide the parents then through further steps that they need to do with their child. So I always make sure that parents understand that there's no quick fix to toileting issues. It's a bit of the hard slog. It can take a little bit of time, and it's to take it step by step. Look at the small wins. Don't be thinking of the overall picture. Really break it down and make it really achievable steps for the child and for the parent too. And there's plenty of reassurance, and that guidance is really important with the follow up.
Sounds really helpful to kind of taking the pressure off, because there are so many kind of milestones that you kind of think, oh, we should be doing this by this point. And, each child is different. So,
Yeah.
to be able to help parents to say, it's okay, you don't have to, by this age, have everything down, sounds really helpful.
Exactly. It is. And each child is so individual, as I said, and there's so many different factors that can affect their toileting. So it is about really breaking everything down and see what we need to work on. And again, as I said, that reassurance that we will get there. It will take time, but it will work at some stage.
And earlier you mentioned something that's very interesting for me as an OT around the sensation of the nappy when a child is learning to pass, have a bowel movement, and the force. So a lot of children that I work with as well that have difficulty in this area, the void of the toilet, the space of the actual toilet bowl is scary. Any tips or ideas for that transition?
Yeah, so the big thing is with that, as you said, the sensation, the difference now with the nappy just gone like that, your whole new thing that they have to do. So sometimes it can be a really gradual removal of the nappy. And a good transition is even the use of a cloth nappy for a while before getting rid of the nappy that they're used to. It can be that they're wearing underwear over their nappy for a while as well. So sometimes slow little transitions like that can really, really help. Again, the toilet itself, when they're sitting on the toilet, is making sure that they're comfortable, that they're sitting in the correct position, that they can feel confident where they're sitting, that they're well balanced, that they're not needing any extra support around them. And if they do get that part of it sorted, but the actual feeling of letting go then in the toilet can be a big one. So sometimes even, they can start by sitting on the toilet with their nappy on. Then once they're comfortable with doing that, it's sitting with the nappy on but having one side open, then transition to having both sides open, and then it can be kind of using the nappy like a little hammock under the toilet seat. So it's still there, it's close to them, and you're gradually then moving it down slowly, slowly into the toilet. And it could even be as slow as maybe cutting the nappy up and pushing that into the toilet bowl so that they still see it. They're still kind of thinking, oh, my nappy is there still, but it's just a little bit further away. And it can be breaking that down even smaller by cutting that in half and, cutting the nappy smaller and smaller in size until eventually they're happy to let it go. So again, really individual for each child, what each child needs. And even things like the sound in the toilet of when the wee hits the water, even having a bit of tissue paper in there at the start as well can really help, that they're not getting the splashback from the wee, or when the poo hits the water, that there's splashback as well. And it can be then the smells in the bathroom. There could be really strong perfumes in the bathroom that can put them off using the toilet as well. So there's loads of different things you have to think of. And it's not, for some kids, it's just not as simple as sitting on the toilet and letting go. And again, when kids are quite anxious when they're sitting on the toilet, they tend to tense everything up. So they're sitting rigid on the toilet and they're nearly sitting on the edge of the toilet bowl. So again, that position isn't great to help relax the pelvic floor. So a little toilet seat insert is really, really important, because you don't want them trying to hang on to the toilet seat with their hands rigid and everything rigid around them. So it's important that they're sitting back nice and comfortably, and then doing some nice blowing exercises while they're sitting. So again, the direction parents are giving their children while they're sitting, there's no point standing over them and saying, come on, pee, pee, you have to pee. You have to be down at their level, do some nice play exercises with them, get them as relaxed as you can. And so a simple thing like blowing bubbles, blowing tissue off your hand. I use like the toilet roll itself, and roll up a little bit of tissue and blow that through the toilet roll. You don't have to go off buying expensive stuff to do this. Use your imagination and use a little bit of play. You can use your hands and pretend they're little candles, blow out the candles. You can do the moo and the hissing sounds. So again, have a competition who can do the loudest moo, the longest moo. And then if you are able to, you can use a tin whistle. So for parents, I would definitely say get some earplugs. But the tin whistle can be great, because kids they love to make as much noise as they can. But it can be a great distraction, and it just makes it a little bit more fun for them.
Oh, I love all those ideas, and I'm thinking even the tin whistle in the toilet roll holder box. Everyone has them in their toilet, so we use the tin whistle when we're on the toilet. It's a great motivator.
It is,
Yeah.
and it's just about making it fun for the child, because the more stressed the parents is, the more stressed the child's going to
Yeah.
be, because they just associate bathroom stress and they're like, no, 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 can't do it. And you know yourself, the minute you're feeling stressed, you're clenching everything. So you have to be as relaxed. And even a simple thing like a warm blanket on their lap, because a bathroom can be quite cold, especially if it's a big, spacious bathroom. And a warm blanket on their lap, or even a scarf, a nice woolly scarf that the mother wears, and the smell of her perfume on it can be really relaxing for the child too. So just think simply things that make them happy and relaxed.
Great ideas there. The other, so going to the toilet is a big one. The other one that parents can get really concerned about is bedwetting at night. And you can nail things during the day, and then nighttime can be a real challenge. Is there any kind of way to approach that, or to make staying dry through the night a little bit easier?
Yeah, so it can be a huge issue and very common issue amongst kids. So again, you have to think realistically about it. For some children, up until the age of 5, they will not have enough of the antidiuretic hormone in their system, and that hormone basically concentrates their urine and makes them produce less urine at nighttime. So naturally, some kids just will not attain nighttime dryness up until the age of 5. So after that age, then it is a trip to the GP just to check out and make sure there's nothing underlying causing this. So it could be that they are constipated and that's what's causing the wetting. Because if you think about it, if they have a full rectum of poo and they're lying down at night, especially if they're lying on their belly, on their side, whatever position they're in, that can make them wee at night time. So that's a big one. Looking then for urinary tract infections to make sure that's not there. Diabetes is another one. So those things need to be checked out by the GP first. But obviously, to try and promote nighttime dryness up until the age of 5, you have to make sure that they've got a really good daytime routine. So for some kids, they will, when you start toilet training, they're just naturally dry at night, and that's fantastic. But for others, they're still waking up with that wet nappy. So you want to make sure that their daytime is really good, that they're weaning regularly throughout the day, but they're drinking evenly throughout the day as well. So for some kids, they may be drinking a load in the morning time, and then they're not drinking anything more until nighttime. So they could be at preschool or creche, whatever, all day, and they're just not drinking anything. And again, kids prioritize play. They're not going to think, oh, I want to drink a load. And that, again, that interception for kids can be quite underdeveloped at that age. They don't understand thirst need, so they just won't drink. So they need constant reminding to do that. So evenly spaced out drinks throughout the day. Try and limit the screen time and the drinks an hour before bed. And then when they're getting ready for bed, they go for their wee, making sure that they're sitting down comfortably and they're sitting for long enough to empty out their bladder. And then do the rest of their teeth brushing, getting dressed, do their bedtime story. And then last thing they do before they go off to sleep and turn off the light is go out for another wee to see if there's anything left. And that can be a game changer for some kids, and getting into that really good routine that can really promote the nighttime dryness. So again, looking at the types of drinks that they're having during the day as well. So certain drinks that have got dark colorings, like the blackcurrant cordials and stuff, they can sometimes irritate the bladder. Obviously, children shouldn't be drinking caffeinated drinks. So again, making sure that they're not in the picture. And it's just having sure that they have a good healthy bladder routine throughout the day. And if constipation is an issue, that's getting treated, because that can be a real instigator. So after the age of 5, then a GP will check them out. If they feel that it's something warranted that needs to be further investigated, they can be referred on to a urologist or to a continence nurse specialist. So there's continence advisors in the community who work really, have great clinics for maybe using a bedwetting alarm. A lot of the time, they won't really do anything about it until they're about 7 years of age. So again, GP, get them checked out and go from there then to see what they need to do.
And can you debunk a myth around toilet training that would be very helpful for parents? Think of your favorite one.
Let me think. Favorite one. Um, so I think the one about being toilet trained in 2 days is a big one that a lot of parents, as I said at the start, when they Google toilet training, they think we're going to nail this in 2 days, job done. So again, I think toilet training comes down a lot to personality and to a parent's expectations around toilet training. So, parents are busy. If both parents are working, it's really difficult, to get that time to put into toilet training. You can have a very relaxed approach to it if you want, and you can really space it out over a long period of time, and be kind of led by the child, which I think is a really, really good way to do it. And again, at this age, children love to be in control, love their independence, want to do it themselves. So that can be a really good way to do it. But again, realistically, if both parents are working, they may only have a week off during the summertime, and they want to get it done. So I would say to those parents is know their routine before you start toilet training. Know how often they're pooing. Know what kind of position they get into when they need to do a poo. How often they need to wee. What their drinking intake is like before you start. So look at all of those things and work on anything that needs to be worked on before you start toilet training. But then preparation is key for your child. Having the potty out, playing with the potty with teddies, explain about what we want to achieve. So rather than just taking the nappy off and say sit there, it's about explaining how our body works when we need to go to the toilet. It's talking about what we feel, inviting them to come with us, talking through what we're doing when we're sitting on the toilet, and then looking at what we produce in the loo too. So it's just being open and honest about the conversation about poo and about wee. And then it's about reading books. It's about getting them to show their teddy how to use the potty. So there's loads of little things they can do in preparation for it. And then try and be as relaxed as you can about it. And, accidents are all part of toilet training, and they are the learning part of toilet training, so a kid learns when they have an accident. And it's important that parents do, look at how they are responding to accidents when they do happen. It's really important to try and stay neutral, try and not shame your child into it. It can be really frustrating, especially if it's dragging on a few days. You're like, oh, no, come on, you need to get it. And I always say to parents, it will take time. Don't expect too much too quickly. Those first few days are going to be tough trotting, and they are going to have lots of wee accidents. So if you have precious furniture or flooring or whatever it is that you want to protect, make sure and protect those. And sometimes if the weather is nice, do it outside. Have the potty next to them, and keep talking to your child, praise them, and making sure that every little effort that they make is praised rather than just the wee and the poo and the potty. And for parents, be as relaxed as you can about it and try and get some help. If you've other things that you need to get done, get other people to do it. But it is about plenty of support for the child and reassurance that they're getting there with it.
You mentioned regression earlier on, and sometimes, it looks like it's going well and then it seems to go backwards. And that can be a real source of concern for parents if there's something really serious going wrong. Is regression just part of the process, or is it an indicator that actually we need to investigate things a little bit more?
So regression, yeah, absolutely, really, really common, and typically about maybe 6 to 8 weeks after we've kind of thought we've nailed the toilet training, regression can hit in. So basically, you need to look at what's happened here. Is there something different? Are the poos again? Have the poos become dry? Have they become hard? Are they less frequent? Are the size of them different? Threadworms is a big one, especially if they're in a childcare setting. That threadworms can really knock back the toilet training. So threadworms pass really easily amongst kids. Again, under the nails, making sure that their nails are clean before they're eating, making sure that they can clean their bum, or with assistance that we're doing that. But typically with threadworms, you'll see them at night. They might be waking up, scratching their bum, and that can really throw off the toilet training. UTIs is one of the biggest one that can really offset the physical side of toilet training. So again, for girls, they're more common because if they're not wiping correctly, they might be wiping from the back to the front, and that bacteria then can get into your urethra. And girls have a really short urethra, so that leads, the bacteria can lead up to the bladder really quickly. So UTIs can present quite quickly in girls, and what you will see is that they're peeing loads, just constantly peeing, and having loads of wee accidents. So that's a big one. So always make sure and think in your head, if regression is happening, is there a urinary tract infection? And for kids, again, they may not typically be the same as what you see in an adult. They might be saying owie when they're going for a wee, but typically it's the wee accidents happening all of a sudden, and loads of them. But then other things that really happen with regression is the change in routine is one of the biggest ones. So what you'll see over the summer holidays especially is the child might have toilet trained early on in the summer. Next thing, the whole family's heading off to Spain for a week, and that totally changes their routine. So the flight, the different foods, the heat, they mightn't be drinking as much, they're having too much fun, so the attention has kind of gone off it, and that can really lead to regression. And then the other side of it too can be that there's such a big focus on them learning for the first couple of weeks. They were getting loads of treats, loads of praise, loads of rewards. And now things are kind of quieting down, and there's no attention on me now for doing the wee and poo and the potty. So there's no interest now. So I'm not going to have any interest. I've got more important things to be doing. So the child's thinking, I'm just not going to bother. So it can be that we just need to go back to basics again with them to really bring it back into play. Use your little rewards if you're using them, making sure that you're getting into a really good routine with them again.
And that is so funny. That reminds me of my 8-year-old who still goes and gets a mini marshmallow every time he uses the toilet in his grandparents' house.
Isn't it amazing? The association they build, unreal.
And so your page, Poo in the Loo, has lots of information. That's where parents can maybe go if there's anything within this podcast that they've listened to and relate to and want more information on. They can reach out to you, private message you. Is that the best way to contact you?
Yeah, so a DM or my email address is on my page as well. So you can send me an email. DM is probably the easiest way, and then we can link back in an email if wanted. But yeah, if there's any questions, I will send on any reels that I feel would be appropriate for them. But if they want to book in for a consultation or do any of my toilet training classes, I have a few different ones coming up now over the autumn, so they can book into those. So do just send me a message and I'll direct them whichever way they need to be sent.
And thank you so much. That has been so practical and really helpful. And I think that's something that really comes through on your page as well, is it's really practical advice. And then you can kind of personalize it to each person as they come through. And, you know, again, one of the things that we're finding across all of our interviews this season is an individualized approach is best. So not comparing your child to other people's children and doing what works for you and your family is really, really key. So really, thank you so much for sharing your extensive wisdom and your expertise on this topic. We really appreciate it.
No problem at all. Thank you so much for having me.
That's all for today's episode on the Irish Occupational Therapy podcast. We hope you enjoyed our discussion and found it informative and engaging. If you've any questions or comments, we would love to hear from you. You can email us at irishotpodcast@gmail.com or connect on Instagram or Facebook.
And remember to subscribe to our podcast so that you never miss an episode. If you found this episode helpful, please leave us a review on your preferred podcast platform. Your feedback is important and helps us to improve the show, so please do leave it. Thank you for listening to the Irish Occupational Therapy podcast, hosted by myself, Jen Trachak.
And myself, Aileen Rutledge.
We look forward to sharing more insights and knowledge with you in future episodes. Until then, take care.